Let me bring in another guest. Dr. Jennifer Kwan is a family physician in Burlington, Ontario, and she's part of Masks for Canada, a group that's advocating for mandatory face masks. Dr. Kwan says masks should be mandatory in all indoor spaces outside of your home, as well as crowded places and public transit. Doctor, thanks for making the time.
Thanks for having me.
Nice to see you. Okay, so this is, I guess it's a group now of mostly doctors, but other scientists and advocates saying that masks really need to be mandatory. We've seen in some places, Ottawa public transit, for instance, Toronto says you have to wear them on public transit. But what exactly are you saying needs to happen with masks in this country?
So we think masks should be mandatory in high-risk settings, which is what you've listed in the ACT acronym: all indoor public spaces, crowds where you cannot distance from others, and transit, including public transportation. So we do make exceptions for anyone who has a medical condition who cannot wear a mask. They should not have to wear one for young children as well. And also, we are advising to avoid any fines or criminal penalties. We want this to be an educational experience to help Canadians understand that masks are important for both health and for economic recovery.
What kind of difference do you think a mandatory mask wearing in those conditions you've set out there would make for controlling the virus?
So right now, the latest leisure poll has showed that about 48% of Canadians wear masks. We need to get to approximately 80% so that it can significantly impact the transmission of COVID-19. This will help ensure that our reopening is safe and sustainable.
I have to say I was out and about a little bit on the weekend, and I am wearing a mask when I go into stores, but there were lots of people not wearing them. And I wonder if it's because people, well, I'm wondering why you think that might be. Is it because people aren't convinced masks work, because they think that they can do the 2 meters and not worry? What is your understanding about why people just aren't doing it?
So the weather has been really nice lately, so it might lead us to let our guard down, especially when the reopening is happening. There's also been initially a lot of mixed messaging about masks, but now the general consensus is yes, masks do work, and you should wear one if you're able to.
So where would you want this directive to come from? From public health officials, provincially and federally, just to start wearing them in a required way immediately?
Well, I think the federal government has said it would be up to the provinces, and I just want somebody to make that decision and ensure consistency, because there has been some individual public health units that have done it, but there needs to be consistency, whether it's all transportation systems or even if they can set parameters for regions to decide if there's X number of cases and there's disease prevalence, then we should have mandatory masking.
What about the enforcement, though? You said obviously you don't want criminal fines or anyone chasing anyone down the street because they're not wearing a mask, but it does seem like even in transit, that is a difficult thing to enforce. It's difficult onus to put on people at stores or on public transit, that they are the ones that have to tell someone to do this.
Yeah, definitely. And I think that right now, if certain stores or regions do this and it's not consistent, then it puts a lot of onus on the store owner to enforce it. So if it's a consistent thing province-wide, that would be very helpful. And certainly stores who have these policies, if they could accommodate people who cannot wear masks with personal shoppers or curbside pickup, or provide masks for people who don't have access, that would also help everybody.
Just remind Canadians again why you believe wearing a mask is important, and why public health officials right now say that if you can't get your physical distancing, you should be wearing one. Just remind people why that matters.
Yeah, certainly COVID-19 is a respiratory virus that's transmitted from someone's mouth and nose to another person's mouth and nose. So having a mask which covers the mouth and nose is very helpful for catching droplets from your mouth and preventing spread of the virus. So approximately 45% of COVID cases can be asymptomatic or pre-symptomatic. So that means you might not know you're infected. So if everybody can wear a mask if they're able to, that will really reduce transmission.
Yeah, you're not protecting yourself, you're protecting the people around you. Just a final question, Dr. Kwan, what has been the response to this?
From general Canadians?
Yeah,
well,
from anyone. What's been, what's from
yeah.
anyone?
Yeah, I think initially maybe it was a little bit confusing to hear all the mixed messages, but I really believe Canadians, are altruistic, we care about one another, we're polite. So masks really are a polite Canadian thing to do, and it's starting to become, cool and fashionable, and it really shows you care for other people and you want to get the economy back on track. So I really encourage everyone to wear a mask if they can.
Okay, Dr. Kwan, thank you for making the time. I do appreciate it very much. That's Dr. Jennifer Kwan.
Thank you.
She's a family physician in Burlington, Ontario. Thank you, doctor.